welcome, ladies and gentlemen, to this show. My name is Reverend Larry Dokeno. It's a joy to be in your homes right now. And we want to present a very special program. And as you know, the coronavirus has ravaged the whole world. We've all been taken captive by this strange virus. And of course, it's brought in its wake so many issues and problems. We are not only fighting a pathological warfare, we're also fighting intellectual, emotional warfare, and also dealing with ignorance. And so all hands really are on deck. Today, we want to present to you a special panel of experts from our community to deal with the effects of this virus. Here in Amsterdam, the Ghanaian community has not been left out in terms of the effect and the impact of this virus. We all have been fighting conspiracy theories and the rest of it, apart from the virus itself. So we, under the sponsorship of the municipality of Amsterdam, we have come together with a campaign to help alleviate or to remove the ignorance and also the issues which this virus has brought with it. I would like to introduce to you my guests this hour, and then we'll be on our way with the program. I have, starting from my right, Mr. Befi Owusu-Sekyere. He's one of the eminent Ghanaian personalities, and he's been involved with the Ghanaian community for a while. And so I'd like to welcome him to the show this hour. Welcome, Mr. Owusu-Sekyere.
Thank you, Pastor.
Yeah. And you may take 1 minute to just introduce yourself, say some more things if you so wish.
Well, very simple. I'm Befi Owusu-Sekyere, community leader. I've been in the community for some time now, starting from somewhere in 1988. Fighting and, agitating for the welfare of Ghanaians and Africans in the Netherlands, especially in Amsterdam. I think that's enough for now.
Thank you so much. Next on my list is Alhaji Yusuf Uru. He's another prominent Ghanaian personality, very much involved at the grassroots level. He's represented this hour the Islamic community in Amsterdam. He's also a part of the Wadata Foundation. We've worked on a few fronts several times. I'd like to invite Alhaji to please say one word or two about yourself.
Yeah, good evening. My name is Yusuf Uru Akondo. And I'm a member of the Wadata organization, and the Wadata organization stands for the West African Muslims in Amsterdam and around. And we have grown now, especially my position is not only for Wadata, but is the Muslim community in Amsterdam. And we've been all along trying to address situations to adapt to life in Western Europe, in the first immigrants. Yeah, now our population is growing.
Okay.
So, inshallah.
I have also in the studio this Miss Francisca Soria Prananta. She's from the Infectious Disease Department of the Municipal Health Services, and I'd like to welcome you to the show. Please tell us a little more about yourself.
Okay, my name is Francisca Soria Prananta. And yeah, as you told me already, I'm a medical doctor and I work for the GGD in Amsterdam. So I hope I can, we can talk today about coronavirus and questions around it.
Last but not least, I have also Dr. Annemiek van Waardenberg. She's from the GGD, the Municipal Health Services, also a house doctor. Let's see the moment to say one or two things about yourself.
Yeah, I'm very nice that I can be here. I also work for the GGD, as you said, and usually I work in Zuidoost here for the teenagers at 2 schools. And also since the corona crisis began, I work for the corona team. So Francisca is my colleague from infectious diseases, and I'm from the youth health care department.
Well, as you can see, we have the social community representatives and also the health experts. So we have the comes, in the house to address the issues, just to set you at ease and to clear any misgivings that might be in the society at this point. Now, I would like to introduce one more person. He is a guest by joining us by Skype, I think. So he is virtually in the studio with us. He is in the person of Mr. Akwesi Osei. He is a sociologist and a researcher. He's done studies on migration and ethnicity. He has done some studies prior on the Ghanaians living in Amsterdam. He's at the moment living in Sweden for his PhD studies. He will present to us a study he's done pertaining to the issues which came up when the study about the antibodies about the Ghanaians came up. And so he would like to give us a presentation to bring out some issues and to clear some of the myths which we have been dealing with at this point in time. Mr. Osei, if you are there, just say a word or two to introduce yourself, and then you can carry on with the presentation.
My name is Akwesi Osei, and I'm a sociologist, and my research area is more focused on West African migrants. Currently, I'm working in Amsterdam, Sweden, and I'm finishing my PhD currently in Sweden, so I'm here just to finish up my work and then return home to Amsterdam.
Please, would you kick off your presentation for us?
Sure. So, in the wake of this whole pandemic, in the wake of the patients and stress and everything, I tried to conduct some kind of social research and see how Ghanaians are dealing or handling this pandemic, of some of the conceptions, the truth, the myths around this whole issue of coronavirus. And this is what I'll be sharing today with you. I'm happy we have experts in the field because part of my presentation touches a little bit about the corona pandemic. But yeah, I'm happy we have experts here. So, as we are all aware, the coronavirus started somewhere in the end of 2019, somewhere in China, Wuhan. And by March 2020, the World Health Organization declared it a pandemic. And since that time, since March 2020, the virus spread across the world with devastating effects on lives. A lot of people lost their lives, and I'm sure many of you saw some of the videos and the media coverage of people in hospitals and how they were suffering, and people in sort of given oxygen to be able to breathe, and those were not sometimes it created a lot of stress and pandemic. It's created a lot of irritation, and people were actually very disturbed and didn't know what to do. But then the Netherlands was not spared. As the disease spread, we also had our fair share of it, fortunately. And I believe the first cases of coronavirus in the Netherlands were reported around February 2020. And it's also spread across the country. And recently, by March 6 March this year, it was estimated that more than 1 million persons or cases were reported in the Netherlands. And unfortunately, we had our first death in March 2020. And currently, we have about 15,000 deaths, according to these figures from the World Health Organization. And the last time I checked, it was March 16. That's when I made this presentation. Just like was done in a lot of countries, our Dutch government and the authorities concerned, the health officials, immediately took steps to educate the public about what to do, and this was done in addition to what the WHO was doing and other health officials, authorities were doing, and we were taught some ways to prevent it, because at that initial stage we didn't have the vaccine, and it was a new virus. It was a new type of the coronavirus, so we didn't even know how to handle it. But then we were fortunate to have some recommendations and safety measures that the government told us to do. So we are told, for instance, to practice a lot of personal hygiene, like washing our hands and using hand sanitizers. We were asked to wear facial masks and also keep a physical or social distancing. And those of us who could work at home were asked to stay at home.
Yeah.
And these are the measures that the government is still stressing that we do. These are still the safety measures that are still in place. And I encourage and advise that we continue to do it. I know sometimes I've had during my interview with Kenyans and other people, I had tell me the facial mask is very uncomfortable to wear, and sometimes people tell me it's difficult to breathe in and all those things. But then we all know it's for our own good.
Yeah.
And the very thing is that the government has always been clear regards to the safety, and the recommended measures to take is to protect us and our loved ones, and it's also there to protect our frontline workers, because those who fall ill, has to be taken care of, and these are doctors, our healthcare professionals, allied health officers who risk their life every day to save other people's life.
Yeah. So let me interject here. Was this study in any way related to part of your PhD research?
So this is not part of my PhD. This is something I did on my own. We all know what happened where a lot of lockdowns and curfews and that. Then now we know there's a vaccine, and the Netherlands has already started vaccination. Then this does not mean that we can just live a careless life. We still have to wear the masks and do all that has been recommended to us.
Yeah.
Yeah. And so you wonder why did I do Ghanaians? Early research from this, when the coronavirus started, there were some 4 ethnic groups in the Netherlands were researched on, including Ghanaians, and it was found that data from the research suggests that Ghanaians were 10 times likely to be admitted, compared to the other ethnic groups. And when it comes to antibodies, we have 20% Ghanaians involved in the study. 25% of Ghanaians involved in the studies had shown antibody positivity.
Yeah.
Which meant that we were asymptomatic. We can have the disease without showing actually the symptoms of it and walk around, and which makes it also even dangerous for us to transfer it. I know this when the results was published, it raised a lot of agitations and concerns with the Ghanaian community, but I'm happy all of it has been addressed, and then people have been educated, and we have moved past it. Yeah. And then another reason why it's necessary for Ghanaians to be extra careful is that the Netherlands have a lot of Ghanaians, and it's estimated that only half of all Ghanaians live in Amsterdam.
Correct.
And those of us who live in Amsterdam know that a lot of Ghanaians are concentrated in the Amsterdam area. So yes, we have that. We do, and those of us who don't even live there, we go ahead and do a lot of things there. So it's necessary for us to really stress on the need for us to protect ourselves and exercise a lot of these safety measures that are in place. I know it brings a lot of, it's changed the way we used to do things. Those Ghanaians are very social people, and we like to meet others and everything, but then with this curfews and all the other restrictions, it's difficult for us to meet and socialize as we used to be. But I should have to stress that it's for our own good. We have talked about some of the symptoms, and then I'm sure that experts will also talk more about it. And yes. So these are just images of the virus. And one thing that I would like to also stress about is the issue of stigma, because this virus and the fact that it is really highly infectious, the disease, created a lot of stigma and a lot of negativity views in the community. And because of that, people were really not comfortable even talking about it, and they were, even if they had it, had they showed symptoms of it, they didn't want to even go to have tests done because of that fear of being stigmatized and all that comes with stigma within the society. So then it did more harm than good, with that stigma associated with the disease. As I mentioned earlier, stigma drive people, when it comes to health, drive people to, discriminate against others who have got certain the disease, prevent people from seeking health care immediately, and also discourage them from obtaining healthcare behaviors. And these are all negatives, things that are associated with stigma when it comes to health. And there are some questions that we need to discuss, but before the questions, I think I would want to also share some, because part of my presentation is talk about the women.
Yeah.
But the sex in our community, and I identified about 10 myths now.
Yes.
One of them, if you can see the slide, that's as we say in our language, corona abrofo areas. It's just white person's disease, and it affects only white persons. But then now we know that from places around us that yes, it's not just a disease for white people, blacks can get it as well. There's no scientific proof that shows that the melanin which we have in our skin takes against the virus, or the blood composition of black people prevent them from getting, protect them from getting the virus. So that myth is been discarded.
Yeah.
Good. There is also that element that drinking local Ghanaian drinks like Sobologo or Bisaba, as we call it, can prevent COVID-19. Here again, there is no scientific proof that these home remedies can help prevent it.
May I just interject here? Is it true that Ghanaians in Amsterdam are drinking this Sobologo to prevent corona?
Yes, almost everybody I've spoken to in the Netherlands have resorted to drinking either Sobologo or some kind of
concoction.
Concoction, you put it that way. Yes, they do. As I said, there's no scientific proof that these things prevent coronavirus.
Okay.
Yeah, you can drink it for because it's refreshing, but then it is not a way one can prevent, you don't drink it to help you prevent coronavirus because there's no proof. There's also that's believe that somebody sitting somewhere created this virus to affect people. No, it's just like any virus or any disease that happens, nobody sat somewhere to create it. There was also this idea that it's only all adults or old people that get it. Yes, whilst the old or the elderly are very susceptible to this disease, young people also get it. I have friends here in my school that 25 years they got it.
Wow.
So yes, and I know in some countries they are report the case of teenagers also having symptoms of it. So yes, regardless of your age, you can get it. There's also that belief that children cannot get it. Yes, the rates at which children get it, and here the health expert will tell us, it's compared to grown-ups, it's low, but then there are cases of children getting it or showing symptoms of it.
Yes.
I told you about the home remedy and cure. Nothing you do at home, the Sobologos, the ginger drink, the hydro, and all those things cannot prevent it. And there was this funny thing, and it's funny but serious. They talk about alcohol. That's when you drink, alcohol, it helps kill the virus inside. And I know people who have resorted seriously to drinking, and you talk to them about it, they think they are preventing corona because they think alcohol kills if you sanitize your towel because hand sanitizer has got alcohol in it. So if it can kill it on the surface, if you drink it, then it means it can help.
Yeah.
There again, no scientific evidence to show that.
Mm-hmm.
And another thing they do here again, like a seed stealing, you know, they hide, like, or they put blankets over themselves
Yes.
and just have that steam. And this is actually something that emerged from Ghana because we used to do that with neem tree leaves. And yeah, I remember that at the beginning of the pandemic, people were recommending that, and people do it now.
Yeah.
Here again, there's no. And yes, vitamin C, people are saying that, yeah, if you take vitamin C, it can prevent it.
Mm.
Yes, it helps you, your immune system and everything, but then taking vitamin C does not prevent one from getting COVID-19.
Did you say taking vitamin C doesn't prevent the infection, but does it help the body's immune system in any way?
Yes, it does. It does help, because we need vitamin C. It helps the body system. Yeah, so you can take it to help your immune system and all those things, but it is not a prevention. We don't do that to cure or to prevent it. If you expose yourself, if you don't practice all the safety measures, you still get it. And there were, and this was, I found this more in Sweden and the Netherlands. There were people who thought because Corona cannot survive in Africa, so they moved back to Ghana, especially so, thinking that the sunlight, the Corona virus cannot survive heat and stuff. But then here again, from the incident, the reported cases in Ghana and other African countries, you see that the sun does not prevent the virus from surviving. Yes, it does not survive in hot climates, but then you can get it. In the cases we have had in Ghana and other African countries speak to that. So going forward, this was the last slide, but then we enter into this sort of discussions, and these are some of the things I got from the field.
Yes.
You know, it's like questions bordering on how do we as a community address the stigma is associated with COVID-19, and how can we get more people to go for testing? Because it appears Ghanaians are afraid of going for testing.
Yeah.
And then given the limited time frame of awareness, like especially what we are doing, because we can only do it to a certain time.
Yes.
Knowing that, what happens, how do we, as individuals, take responsibility for ourselves? Because it's not just ourselves that we are protecting, or we are also protecting those loved ones, the normal person, the average person who are working in public, people we sit in the trams and other, so we need to take initiatives. We need to take personal initiatives for us to be able to address this issue.
Well, thank you. So we're not going to move into the discussion phase, but I would say if you have any, let's say, leading questions or remarks based on what he presented, we can at least bring them up now so we don't forget them. So if anybody has any remark or question based on the presentation, you may bring that up now.